Hi everyone, my name is Kavita Chauhan, and today I'm going to talk about my WomenLift Health leadership journey and my leadership project. I'm a principal consultant and India Health Hub lead at Oxford Policy Management. And the title of my leadership project is Women Leaders in Behavioral Sciences, looking at pathways to leadership. To give you a brief background, there's little documentation of Indian women leaders, whether it's scientists, practitioners, researchers, or communicators who have made an impact on the lives of people in the field of public health and behavior change, and who have succeeded in pushing boundaries and making a mark for themselves. Their leadership journeys and how, through their work, women have addressed barriers and integrated gender considerations into their approach to behavior change are not widely known. We all know that gender identity plays an important role in how women leaders are perceived and in shaping the self internalized beliefs of women as leaders. This often impacts opportunities, both for women who seek them and the ones who provide these opportunities. There is a need to celebrate women leaders and amplify stories of change and encouragement. Through this project, I plan to document the leadership journeys of women who have worked on social and behavior change for public health. And through their lived experiences, I aim to present an analysis of factors that have supported or hindered their pathway to leadership. I hope the analysis of these factors can be a source of learning and inspiration for other women leaders. We all know that social and behavioral sciences are at the heart of many public health interventions. I'm passionate about behavior change. However, there is limited documentation of stories of change led by women leaders in this area. So, through this opportunity, I can connect with a wider community of behavioral science leaders, learn about their contributions, their journeys, and hope to draw inspiration from it. I will be able to gain greater insights into leadership concepts, approaches, and their application. My project is divided into 5 phases. In the inception phase, I mapped key informants, conducted a rapid test review, and in discussion with Hitakshi and Arjuna, developed a study framework based on which I also developed a study tool, which focuses on approaches and leadership styles, gaining insights on perceptions and understanding of their role as a leader inside and outside an organization, key enablers and challenges, and how did women leaders overcome it, and what do leaders need to do according to them. I plan to now conduct key informant interviews and hope that the analysis will draw insights on these aspects, which I've mentioned in the design phase. And also, I hope to engage with women health leaders and other colleagues to discuss and validate these insights. I then plan to individually and through Women Lift Health and other online platforms share these learnings widely. Overall, so far, I've learned that leadership is an evolving process and has become a distinct and recognizable discipline of research and training. There are several frameworks and approaches. Generally speaking, there are 3 broad aspects which influence leadership, and those are personality, situation, and the setting. Leaders must connect with themselves first before they can inspire others. Evidence suggests that leaders are adept at defining and acquiring logical leadership skills, but feel less confident in using these alongside soft skills such as self awareness, humility, vulnerability, and resilience. The path to becoming an authentic leader is nonlinear and varies according to individual traits, challenges, and practical steps. And how leadership builds resonance will determine how people move towards shared dreams. Leadership journey for me has been transformative in more than one ways. Firstly, through several self-assessments, I think it has brought in better self-awareness and clarity of purpose. Learning about leadership concepts, approaches, and styles has been enriching, and the interactions with fellow women health leaders has really helped putting things and concepts into perspective and driving towards solutions. Also, the network and connections that we've built, I hope we continue to engage with each other. And the platform has really helped in the exchange of ideas, perspectives, and cross learning. So I'm really grateful for this opportunity to the entire Women Lift Health leadership team and also fellow women health leaders. Thank you for your time today, and I look forward to receiving any questions you may have. Thank you so much.